Hey everyone, welcome back to my channel. In today's video, we're going to be talking about a topic that affects many women, but is often not discussed openly: bacterial vaginosis. BV is a common vaginal infection that can cause discomfort and embarrassment, but with the right knowledge and treatment, it can be easily managed. So if you or someone you know has been struggling with BV, stick around because we're going to be discussing everything you need to know about this condition. Bacterial vaginosis. Bacterial vaginosis (BV) is a common vaginal infection caused by an imbalance in the normal bacteria in the vagina. BV occurs when the balance of bacteria in the vagina is disrupted, with an overgrowth of harmful bacteria such as Gardnerella vaginalis, Mycoplasma hominis, and Prevotella species. Symptoms of BV include a thin, white or gray vaginal discharge, a fishy odor, itching or burning in the vagina, and sometimes vaginal bleeding. However, many women with BV do not experience any symptoms. BV is not considered a sexually transmitted infection, but having sex with a new partner or multiple partners may increase the risk of developing BV. Douching, using scented products, and smoking can also increase the risk of BV. BV can usually be diagnosed by a healthcare provider based on symptoms and a physical exam. Treatment usually involves antibiotics, either as an oral medication or as a vaginal cream or gel. It is important to complete the full course of antibiotics, even if symptoms improve, to prevent the infection from recurring. To prevent BV, it is recommended to avoid douching, use unscented products, and practice safe sex by using condoms. Maintaining good vaginal hygiene and a healthy lifestyle may also help prevent BV. Bacterial vaginosis causes. The exact cause of this imbalance is not fully understood, but it is thought to be related to a combination of factors including overgrowth of certain bacteria. In bacterial vaginosis, there is an overgrowth of bacteria that are normally present in the vagina, such as Gardnerella vaginalis, which can outnumber the normal lactobacilli bacteria that help maintain a healthy vaginal environment. pH imbalance. The pH of the vagina is normally slightly acidic, which helps to prevent the growth of harmful bacteria. However, in bacterial vaginosis, the pH becomes more alkaline, which can promote the growth of harmful bacteria. Sexual activity. Although bacterial vaginosis is not considered a sexually transmitted infection, sexual activity can disrupt the balance of bacteria in the vagina and increase the risk of developing the condition. Hormonal changes. Changes in hormone levels, such as those that occur during menstruation, pregnancy, or menopause, can also affect the vaginal environment and increase the risk of developing bacterial vaginosis. Antibiotic use. Antibiotics can disrupt the balance of bacteria in the vagina, increasing the risk of developing bacterial vaginosis. Bacterial vaginosis symptoms. The symptoms of bacterial vaginosis may vary from person to person, but the most common symptoms include vaginal discharge. The discharge may be white or gray and have a strong, fishy odor. Itching or irritation. Some women may experience itching or irritation around the outside of the vagina. Burning sensation during urination. BV can cause a burning sensation when you urinate. Painful intercourse. Some women may experience pain or discomfort during sexual intercourse. Thin vaginal discharge. BV can cause the vaginal discharge to become thin and watery. It's important to note that not all women with bacterial vaginosis will experience symptoms, so it's possible to have the infection without knowing it. If you suspect that you may have bacterial vaginosis, it's important to see a healthcare provider for proper diagnosis and treatment. Bacterial vaginosis diagnosis. The diagnosis of BV typically involves a combination of a physical examination and laboratory tests. During the physical examination, your healthcare provider may ask you about your medical history and symptoms, and perform a pelvic exam to check for signs of BV, such as a grayish-white vaginal discharge with a fishy odor. In addition to the physical exam, your healthcare provider may also perform laboratory tests, including wet mount test. This test involves examining a sample of vaginal discharge under a microscope to check for the presence of bacteria. pH test. BV can cause the pH of the vagina to become more alkaline than usual. A pH test can measure the acidity of your vagina to determine if it is normal or elevated. Whiff test. This test involves adding a solution of potassium hydroxide to a sample of vaginal discharge to check for a characteristic fishy odor. Culture test. This test involves growing a sample of vaginal discharge in a lab to identify the specific bacteria causing the infection. It's important to see your healthcare provider if you experience symptoms of BV, as untreated BV can lead to complications such as pelvic inflammatory disease (PID) and an increased risk of sexually transmitted infections (STIs). BV treatment options. The treatment for BV involves antibiotics to restore the normal balance of bacteria in the vagina. There are several antibiotic options for treating BV, including metronidazole. This antibiotic can be taken orally or used as a topical gel or cream. It is usually prescribed for 7 days. Clindamycin. This antibiotic is available as a vaginal cream or suppository and is typically prescribed for 7 days. Tinidazole. This antibiotic is similar to metronidazole and can be taken orally for 2 to 5 days. It is important to complete the full course of antibiotics as prescribed by your healthcare provider, even if your symptoms improve before the medication is finished. In addition to antibiotics, your healthcare provider may recommend probiotics or other lifestyle changes to help prevent BV from recurring. It is important to see a healthcare provider for a proper diagnosis and treatment plan for BV.